Welcome everybody to this presentation. Today, Dr. Vijay Parul will talk about a trial of the mind diet for prevention of cognitive decline in older persons. Dr. Vijay is a senior scientist at Renix who leads bioinformatics, genomics, and next generation sequencing research related activities in the organization. He is currently working on the new antigen cancer vaccine pipeline projects here. Vijay holds a PhD in Life Sciences from TMC Actrek, Homi National Institute, Navi Mumbai. His PhD study focused on cancer genomics. Previously, Vijay has worked as assistant professor at graduate and postgraduate degree colleges as well. At Renix, he has gained experience in scientific, operational, and administrative matters. So let's welcome Dr. Vijay for today's presentation.
Thank you, Dr. Nupur, for the introduction. For our today's Cell Talk presentation, I have chosen a research article that is describing trial, a clinical trial. That is trial of the mind diet for prevention of cognitive decline in older persons. The original authors are L.L. Barnes, Dhana, Yu, et al. The title is Role of Anecdotal Diets in Maintaining Cognitive Health in Aging Individuals. The topic selected for this subject is role of cognitive health in aging. The journal for publication is the New England Journal of Medicine. Its impact factor is 96.2 and year of publication is 2023. This research has impact on aging, longevity and cognitive health. So in today's paper, they have described a clinical trial where they are trying to establish positive effect of particular diet on brain health. So in aging population, there is a problem of dementia and which can progress to Alzheimer's disease. So there is a need to identify preventing strategies to avoid these outcome in the older age groups and these degenerative diseases management. So one possible approach, it could be the lifestyle changes and also changes with respect to diet. There are many diets which have been anecdotally uh, supposed to have positive impact on the brain health and also cognition in the older people, but scientific evidence or evidence based on clinical trials is not available. So there is a large variety of common diets followed all over the world, which is linked to the better health in the older people, such as Japanese diet, Mediterranean diet, etc. So some of these regional diets have been found to be putatively associated with healthy aging and longevity. And one such diet is DASH diet, that is dietary approaches to stop hypertension, or which is commonly called as a Mediterranean diet. And this diet is supposed to reduce cardiovascular risk factors. General background, most clinical trials that have ever been conducted, they have been conducted on compulsory diets, and they have been conducted primarily with respect to cardiovascular health itself. So the scientific studies regarding the cognitive health or brain health, these are not available. And these diets which can affect the cardiovascular health can also affect the dementia. Therefore, this diet, that is dietary approaches to stop hypertension, DASH diet or the Mediterranean diet, can have an impact on the cognitive outcome in the older people also. So in this particular trial, they had devised a diet which is called as MIND diet, mind diet, and which is a hybrid of Mediterranean DASH intervention for neurodegenerative delay, that is Mediterranean diet and DASH diet. So this mind diet, it is putatively associated with the decreased risk of Alzheimer's disease, slower cognition decline, and fewer neuropathologic changes of Alzheimer's disease. So all of these are anecdotal associations, and rigorous scientific identification of that link is not established. So in this mind diet, it emphasizes the consumption of plant-based foods, which include the green leafy vegetables, nuts and berries, fish and olive oil. And along with that, this diet also limits the intakes of food with high levels of saturated fat and sugar. The foods such as red or processed maize, butter and margarine, whole fat cheese, pastries and sweets, fried foods, these are avoided in this particular diet. Present challenges for this particular area is that there is limited data is available from trials of dietary intervention for brain health in the older people. Objective of the current research was to perform a randomized trial of the MIND diet to identify its effect on the cognitive decline in older people. The methodology that was followed for this particular clinical trial, it was the trial design consisted of two-site trial, which lasted for 3 years, and this trial was a randomized control trial. The past participants were randomly assigned to two groups, one group that followed MIND diet and another group that followed the control diet. So in the MIND diet, the diet was with mild caloric restriction aimed at weight loss, and the goal was to consume 250 kilocalorie less per day. And in control diet, the participants followed their usual diet, but with the same mild caloric restriction as followed in the MIND diet aimed at weight loss. The eligibility criteria for inclusion were defined as persons with 65 years of age or older were included, and they should be with a score of at least 22 on the 30-item Montreal Cognitive Assessment Test. So here in this particular test, lower score means more cognitive decline, and therefore these participants are having at least 22 score. That means better of cognitive performance. Other criteria was that they should be overweight with BMI greater than or equal to 25. And also they should have a reported family history of Alzheimer's dementia with at least one first degree family member having a history of developing Alzheimer's. And also the participant should be with suboptimal diets with respect to the putative brain health. Participant recruitment, it was carried out from January 2017 through April 2018 at two sites, and these are the two centers for this study, Chicago and Boston metropolitan area. Participant screening was performed after recruitment, and for that telephonic information collection was applied. So they collected information about age, family history of dementia, diet quality, food allergy, use of nutritional supplements, use of medications for Alzheimer's disease or Parkinson's disease. Then after recruitment, the participants were randomized into two groups, that is MIND diet group and control diet in 1:1 ratio. The trial design, it consisted of assignments of the patients, participants into the groups, and which were stratified according to trial site, age, and also age categories, which were further stratified into 65 to 69 years of age, 70 to 74 years, 75 to 80 years, 81 to 84 years. At the start of the trial and at subsequent time points, measurements were taken. Baseline measurements included height, weight, blood pressure. Then tests of cognitions were performed. Questionnaires were given to the participants. Example question being 24-hour dietary recall and food frequency questionnaire. Participants were assigned to diet group by research staff at Data Coordination Center. And participants were instructed to follow their assigned diets for 3 years time period. And for this particular trial, key data points were collected at different time points, that is 6 months, 1 year, 2 year, and 3 years. The endpoints that were defined for this study was the change from baseline in the global cognition in specific cognitive domains through year for the participants. The secondary endpoint that was defined was changes from baseline in MRI, derived measures of total brain volume, hippocampal volume, and volume of white matter hyperintense lesion. So in a primary endpoint, they looked at the functional aspect of the brain, and in secondary endpoint, they measured the physical aspect of the brain, that is brain value, and whether the diet is having positive impact or negative impact on these two functional and physical aspects. So this diagram defines the methodology of the study. So 1,929 persons were assessed for eligibility, out of which 1,325 were excluded for the given reasons. 604 participants that finalized where they underwent randomization. 301 were assigned to the MIND diet and 303 were assigned to the control diet. Through this study period, 4 patients in the mind diet died and 6 patients in the control diet died. And at the end of the 24 months time period, 301 completed in the mind group and 303 completed in the control group. Results. So these are the demographic and clinical characteristics of the participants. The point to be seen is that there should be balance between the two groups. In the mind diet and the control diet, age, male, sex, race, education, these were compared. So apart from the apolipoprotein E epsilon 4 allele carrier. In the control diet group, they were more in number as compared to the mind diet. So this, apart from this, the two groups were well balanced. So they took global cognition scores for this 3-year follow-up. So at the baseline, half year, 1 year, 2 year, and 3 year. So these were the number of participants that were retained in the study, and this is the estimated mean change from the baseline in the mind group and the mind diet group and the control diet group. So as you can see, there is a very minimal change in the from the baseline in the mind diet group, also control diet group, and no statistically significant difference was found within the mind diet group and control diet group, p-value being 0.23. Here also we can see that both the groups, that is the mind diet group and the control diet groups, they showed similar patterns in the cognition score throughout the study period. So regarding the second endpoint, secondary endpoint, this is the imaging results, MRI-based results in the mind diet group and control diet group. So white matter hyperintensity is hippocampal volume and gray and white matter. So the white matter hyperintensity increased in both the groups, while hippocampal volume and gray and white matter it decreased in the both the groups. So similar outcome was found in mind group and the control diet group. So the results with respect to primary and secondary endpoints, the mean change in the global cognition score did not differ significantly between the trial groups, with an estimated mean difference at the end of the trial of 0.035 standardized unit. In secondary endpoint also, white matter hyperintense volumes increased in both mind diet group, and hippocampal and total brain volumes decreased in both groups. Coming to discussion, the mind diet, it includes foods and nutrients that have been putatively associated with preserving brain health. So findings from observational studies, they have reported that there could be a positive effect on the brain health in the older people, but the mechanistic evidence how this particular diet carries out that particular effect, it is not well established. So previous meta-analysis of diet trials, they have shown mixed results and generally do not affirm the beneficial effects of the diet on cognition. So it is possible that these interventions do not improve cognitive functioning, or maybe we require a longer trial period to actually establish the effect of these diets on the patients in a longer time frame. The study also had some limitations. So some limitations, those were that the participants were required to have certain risk factors, those being the family history of dementia. They should have suboptimal diet before randomization and be overweight. So due to that, these findings cannot be applied to people who do not have family history of Alzheimer's, and also who are not overweight, and also who are following optimal diet. Another limitation was that study participants were mostly well-educated people with approximately 15 to 16 years of education. So the less educated people were not represented adequately. And these older adults were mostly of European descent, and approximately 10% of participants were black. So therefore, these findings cannot be generalized to the persons from other diverse ethnically or racially background, diverse backgrounds, and people with less education. Conclusion, in this trial of mind diet that was designed to improve brain health, cognitive function, and brain imaging outcomes at 3 years did not differ significantly between participants who followed the mind diet and those who followed a controlled diet with a mild caloric restriction. So, is a debate about whether diet can have a positive impact on the brain health, or would dietary changes help older people to age more gracefully, maintaining the cognitive health. So in that case, we can say that it may not be absolutely correct. All the anecdotal things that are said about diet, that particular diet is good for brain, so that cannot actually come out. But there is also another aspect that this particular trial period, which lasted for 3 years, so maybe a longer time duration study may provide better results. The impact of the research is that diets which are typically associated with providing health benefit in older ages may not actually have a positive impact on the cognitive health of the older people, and more rigorous studies with longer time period are needed to assess the actual impact of the health types. Thank you for listening patiently.
Thanks, Vijay, for your well-explained presentation. The forum is now open for questions. If you have any question or any comments, you please type in the chat box. I do not find any question or comments in the chat box. So let's thanks Vijay once again and look forward the next presentation. The next presentation will be scheduled on 31st July 2024. It will be presented by Ms. Somadatta Basak, and the title is Association Between Sarcopenia and Cognitive Function in Older Chinese Adults. Evidence from the China Health and Retirement Longitudinal Study. Thank you everybody for joining to today's sessions.